Okay, we're back with celebrity dentist Dr. Austin. So, can you contract COVID-19 from your toothbrush? If so, how often do you recommend us replace our toothbrush to avoid contracting the virus?
Absolutely, you can. So we recommend that you toss your toothbrush every 3 months. But if you have caught a common cold or some kind of virus, toss it before 3 months. Very important.
So how would you recommend cleaning your toothbrush? So antibacterial soap or mouthwash? I tend to do the soap, but I want to know what you have to say.
Well, since I would recommend dipping it in hydrogen peroxide, you can dip it in the 3% full hydrogen peroxide.
Okay,
Okay.
so say you're quarantining with a friend or relative. Is it okay to share dental hygiene products such as toothpaste, dental floss, mouthwash, water pick, any of those things?
Never ever share a toothbrush. That's nasty and
Yes.
you can spread infection.
Ugh.
What you want to do is make sure that you wash your hands first, rinse with the hydrogen peroxide, wipe down your toothbrushes with either alcohol or bleach, and then brush your teeth. Now, what you want to do with your toothbrush is you want to social distance your toothbrush. Keep it away from other toothbrushes. You might want to tuck it in a medicine cabinet or somewhere away from other toothbrushes so that it does not get infected as well.
I didn't even think about that.
Yeah, same.
Oh my goodness. Well, what cleaning techniques would you recommend for people who wear braces or retainers or mouth guards?
Nothing really changes. You can use a floss threader, water pick. I think water picks are the best thing because people don't like flossing, and water pick is the tool that is like a car wash for the smile. If you have a mouth guard or a Invisalign aligner, make sure you keep it in the case. Don't set it down on the surface. I know it's easy. You take it out, you drop it on the surface. Make sure that you're not doing that. And you can use soap and water or hydrogen peroxide as well to keep it clean, those tools clean.
I did hear you mention that some dentists are switching to telehealth to work with patients so they don't have to come into the office. Based on your experience, kind of what is the process for that? Because I just think of having to be face-to-face with a dentist.
Well, there's certain things, and I actually have been doing it for a while. We can do a Zoom meeting or FaceTime. Zoom is probably a little bit more secure. And I'll dial in and have a video chat just like we're doing right now and simply have the patient open up. And there's things that we can see. We can see a cavity or a chipped tooth. We can see plaque, red or bleeding gums. Those are all signs of infection, and we can advise you. Now, you may not be able to go to the dentist to get that small cavity fixed now, but we can tell you certain things. There's certain things we can't see that are hidden between the teeth, and it does require x-rays, but general questions we can answer, and we can see the signs and symptoms of problems just by video chatting.
And so what would you recommend for those people, obviously the telehealth, but for people who kind of like to do things at home and are actually afraid of the dentist? What would you tell them to do at this time?
Well, at this time, there's not too much you can do. If it's not essential, follow that 4-step smile workout routine, brush, floss, rinse, and scrape, and just be careful with how you use your teeth. Don't open up bottles. Anything that could cause problems in the next 3 to 6 months, just take it easy. And hopefully soon in the next month or two, we'll be back to normal business and you can get your non-essential things taken care of. But again, if you have swelling and pain that keeps you up at night, you can still call your dentist. There are dentists that are still actually practicing fully.
And just, you did mention that you guys do sterilize your tools. Can you just speak to people who are hesitant to go to the dentist for an essential service, like they have a pain in their tooth and they know they need to go, but they're kind of concerned about actually contracting the virus?
Well, I would recommend that you interview your dentist. They're going to ask you lots of questions about your travel, maybe temperature take when you come in. Ask the dentist, what are your how are you keeping this office clean? Can you explain to me what you're doing to keep me safe? I think it's a very fair question, and it wouldn't, if someone asked me, I would be proud to say, hey, I sterilize everything, or hey, I'm using disposable, instruments that I toss and I wipe down with 100% alcohol, the things that we do to make sure that we keep patients safe. So interview the dentist. We're going to be interviewing you. And the name of the game is that everybody feels safe. We're scared too, because our risk as a dental professional to catch the virus is really, really high. We're like in the top professions in the healthcare field that are susceptible. We don't practice social distancing.
Right.
We're right in the area where the aerosols and the saliva live. So we're just as scared and nervous too. So we all want to stay healthy and safe.
You're definitely reassuring.
Yeah, because you think about that, but I wasn't even thinking about separating my toothbrush. I guess I just don't think about it, and now I'm like, okay, I got some stuff to do when I get home.
Yeah, there's a new normal, so we have to think very carefully on how we practice our oral health, and things are just going to be different, and we have to be mindful.
Thank you. All right. Thank you so much, Dr. Austin, for reminding us to
Thank
continue to
you.
practice dental hygiene, brush our teeth, and not share dental hygiene products.
Never even crossed my mind.
Exactly. All right. We'll be right back on Being a Woman. Stay with us.
Oh, thank you so much.
Hi, thank you so much.
Hi.
Thank you. Look, making sure my teeth are clean.
I want to jump into some of those conversations. I love the show.
Oh, thank you.
We appreciate you so much.
My pleasure. You guys have a great day.
You
as
too.
well.